Hi, my name is John Edwards. I'm a board-certified neurosurgeon at Summit Brain and Spine. And today I want to talk about a couple of guiding principles for how we achieve the best outcomes for our patients. When I was in medical school, I read a book called Better by Atul Gawande. A chapter in that book was about a pediatrician in Minnesota who had the best cystic fibrosis outcomes in the world. Dr. Warnick looked for every opportunity to deliver better care. He innovated. He didn't accept standard results. He believed that excellence came from seeing on a daily basis the difference between being 99.5% successful and being 99.95% successful. I remember calling my dad and relating to him my newly found enthusiasm. I told him I wanted to find ways of making patient outcomes as good as possible. I wanted to innovate and creatively and deliberately work towards what Dr. Warnick did with cystic fibrosis, but in the field of neurosurgery. Well, a few years later, I started residency and then neurosurgical practice. I realized how hard it is to consistently have good results. At times, I became very discouraged. I reread Dr. Warnick's story. I realized he met with his staff every week. They rigorously tracked data for their patients. I decided we would do the same thing. So we did. I invited anyone who wanted to come and discuss patient cases with me. A few providers started coming. We learned from each other. Eventually, I invited 20 or 30 providers that help us take care of patients around the time of surgery, to look at the way we were doing things and how we could get a little bit better. This group included leaders in the preoperative area, in the OR, the PACU, the surgical floor, and home health. We had physicians and nurses and pharmacists and scrub techs and pain psychologists and a few others contribute to the discussion. And we looked at our data. The results were remarkable. Hospital stay decreased. Narcotic use decreased. We saw less nausea and constipation and other side effects from the medications. We saw fewer wound issues. We saw better outcomes. Recently, I listened to Michael Dunn, a communications expert and religious leader, share a story about the British cycling team. He said they were the laughing stock of the cycling community for a century. They tried everything, including expensive overhauls and training programs and other things. In 2003, however, Sir Dave Brailsford was hired. And unlike other coaches who attempted dramatic overnight turnarounds, Sir Brailsford instead committed to a strategy he referred to as the aggregation of marginal gains. This entailed implementing small improvements in everything. That meant consistently measuring key statistics and targeting specific weaknesses. Brailsford said, the whole principle came from the idea that if you broke everything down, you could think of all that goes into riding a bike and then improve it by 1%. You will get significant increases when you put them back together. At Summit, we meet every week with anyone interested in this journey. We have held and plan to hold yearly conferences. We are investing in ways to rigorously track outcome data. There is a message embedded in this for every patient too. Sometimes answers are more complex than one thing. Patients often bounce from one clinic to another, and they'll say, I tried chiropractic, I tried physical therapy, and then I tried pain injections, and I've done medication, and they didn't work. Therefore, I now need surgery. What if we considered making small gains in all of these areas and carefully implemented surgical intervention when needed? I think that is something that every patient should consider. Dr. Warnick had the best cystic fibrosis outcomes in the world. The British cycling team since 2003 has won the Tour de France 6 times and numerous gold medals. My hope is we can apply these principles for the best outcomes and healthiest lives possible for those we serve in our community.